When you say mute, it's like this, don't it? That means they mute me, no? No?
Good afternoon, everyone. Good afternoon, and how are you? Thank you so much for joining us today. This is our fifth session and the final in our infection control series. Thank you so much for those of you who've been with us so far. Welcome to those who are joining us for the first time. I'll officially hand over to our moderator in a short while. But as we have done for the last 4 sessions, we have a very short brain teaser for you today. And so I want you to listen carefully to the instructions. We're asking you, I'm gonna put the picture on the screen. You are going to write based on what I've asked of you, but the instructions for the answer is you're gonna put how many in the chat. So if you found 15, write 15 in the chat. The person who has the most, we are going to contact you as the session is in progress, and you will have to show us what you wrote down and how you came up with the number you did. All right? So prepare yourselves. We have so far been doing mostly English, and today we're gonna challenge your brain just a little bit different. So I want you to listen again. I am going to be putting the picture on the screen just now. I'm gonna ask you to write down how many do you see. You will have 30 seconds to write down what you have found, but when you're putting your answers in the chat, we are asking you to put the actual number. So if you found 10, write 10, but we don't want you to write out what those 10 are as yet. We only want you to write the number 10. All right, everybody's ready? All right, let's share the screen. So this is our brain teaser today. Write down how many numbers you see. 30 seconds starts right now. Time is up, time is up, time is up. So I want you to listen again now. In the chat, either on YouTube or on Zoom, write how many numbers you found, and then when we contact you, you will have to show us what were those numbers that you found. Thank you so much for participating, and I'm going to officially hand over. As we've been doing for these sessions as well, we've been encouraging our membership to participate, and so our moderator today is Ms. Sidonia Lyon, who is one of our nursing students from Omega Kappa, who is from the University of the West Indies Mona campus. So have a good evening, everyone. Over to you, Ms. Lyon.
Thank you so much, Mrs. Garrix-Lloyd. It is my privilege this afternoon to welcome the President, the Vice President, chapter members, participants, and all persons present for this afternoon's seminar. To those joining on both YouTube and Zoom, welcome. My name is Sidonia Lyon, and I will be moderating the program this afternoon. For all those who were unable to join, the video will be made available at the Omega Kappa YouTube channel. For this afternoon's program, the presenter will be Mrs. Lillian Lewis McDonald, and our topic is infection prevention and control. Before I go any further, however, we must remember the rules. Be reminded, that if you are joining on YouTube, please write your names in the chat. Those on Zoom, please mute your mics and videos. And remember, you do not have to type your names in the chat. If there are any questions, please wait until the end of the presentation to raise your hand and wait to be acknowledged. Questions may also be typed in the chat section and will be answered during the Q&A segment. This evening's presenter is a lady of honor. She has a Bachelor's of Science in Health Service Administration. She's a certified nursing administrator, as well as an RM and an RN. She's married to an awesome man, and together they have 2 beautiful daughters. She has been a nurse for 20 years, and in 2018, she was placed first runner-up in the NAJ LASCO Nurse of the Year competition. She currently serves as the Infection Prevention and Control Nurse at the Victoria Jubilee Hospital. She loves the languages and aspires to travel the world. She believes that with Christ, all things are possible, and this has given her the platform to help as many people as she can. Please, let us open our hearts and minds this afternoon to her presentation. I present to you none other than Mrs. Lillian Lewis McDonald.
Thank you very much, Sidani. Thank you so much for your introduction. And a good afternoon, everyone. It is indeed my pleasure to be here this afternoon, sharing with us on infection prevention and control. A few years back, it would have been considered a strange topic, but with what is happening with COVID-19, it's as if it has been blown and pushed forward almost instantaneously. I just want to share with us today that infection prevention control, it's not new. It's from way back. It's just that we would have been practicing that way, but not probably recognizing that we were practicing that way. All right. I'm just going to be setting up in terms of my sharing of my screen. So while I get ready for that, like I was saying, okay, right here. All right. Okay, so we're going to be speaking about infection prevention control. And like I said, it's not something new. It's not something that we are not aware of. And it is not something that is solely designated or fully in the hands of the infection prevention control nurse. It's actually something that we're all involved in one way or the other. Previously, we might have thought it was just at the hospital level. But like I said, with COVID-19, it has shown to us that infection prevention control practices has to be done everywhere. You're going to be doing it at home, at school, at play, at church, everywhere you are these days with this event of the pandemic that is happening. So infection prevention control actually involves a lot of, it's a fulsome team, multidisciplinary team approach. And I'm going to just be sharing with you some of the things we're going to be covering. I know we have a 2-hour span, so we're not going to get bored. We're going to do some movements, some Jamaica moves and everything, because, you know, after sitting for a while, we may start getting drowsy, we might start feeling a little cramped, but we'll be going through. So at the end of this session, we will be able to explain the activities that are involved in infection prevention control, IPEC for short. We'll be able to outline some of the main concepts to consider in infection prevention control. We should be able to describe the WHO's 5 moments of hand hygiene. We should also be able to state the considerations for choosing our personal protective equipment, the PPEs, which are buzzwords now. We will also be discussing the management and disposal of sharks, as well as describing the steps to be taken in cases of occupational exposure to blood and body fluids. We'll also be demonstrating the steps involved in hand hygiene. So we're gonna get our hands in the game. And we're just gonna be looking briefly at some of, well, we're basically going to be looking at what the functions of the IPC nurse is assigned to as we go on through the presentation, but we'll just sum it up in our objective 8. All right, so let's get in. So the scope of activities that are involved in IPC. Like I was saying, it's a multidisciplinary approach. Sometimes when I think about it, I look at IPC, infection prevention control, as the glue basically that fits everything together. Now, this multidisciplinary approach is aimed primarily at reducing healthcare or hospital acquired infections among staff, patients alike. All right. So, with the pandemic, it has forced us to look, like I said before, not just in the hospital setting or perhaps the long term care settings or at the daycare, but basically everywhere we are in the doctor's office, everywhere that you congregate, you're going to be looking at infection prevention control. Now, um, the infection prevention and control in Jamaica became more recognized, I would say, or appreciated, if that's a better word to use, around 2015. You know, it kind of just jumped to the fore as well because of an outbreak among some premature neonates at a prominent health facility. And it was after that that you found that even our government, the Ministry of Health, would have, made some steps in ensuring that each hospital, each facility has infection prevention control personnel, and they started opening their eyes and becoming a little bit more aware that what we were lobbying for, the standards that we were trying to achieve, these things are quite important. All right. So in infection prevention control, firstly, we or one needs to understand what how diseases are spread. All right, because we're speaking about infection and we're speaking about how we prevent them, as well as the control measures that we're going to be using. And as we are nurses in this on this platform, and for those who may not be nurses, there is usually a chain or a triad that is usually mentioned as it relates to how you will intercept or prevent diseases from happening. So there are elements that will contribute, but also we need to understand how we're going to be impacting or intercepting or interfering with this chain from being formed. So you have the infectious agent, which can be viruses or fungi or bacteria, and you'll have the reservoir where the actual casing or where it will be housed. So this can be people, this can be on equipment, this can be water, this can be fomite. You also have the portal of entry. So the portal of entry is how this, how will this actually get into the system? So it could be through the respiratory tract, it could be the GI tract, it could be the mucous membranes, it could be the skin. You have the portal of exit, where is it coming out through excretions, through body fluids? Is it coming out through, how is it coming out in droplets or in aerosols? There's also the mode of transmission. So what is the bus that takes this infectious agent around? So you'll have direct contact, you'll have a droplet flow, you'll have aerosolization. And also, in order for this mix or this chain to be completed, and a disease is formed, you'd need a susceptible host. And when I make presentations, especially at work, I usually say to my team that in order for you are going to be, we're always going to be existing with diseases. In fact, we have natural flora in terms of diseases occurring in our bodies, and it's only when we become susceptible, when our systems are weakened, that these diseases or these organism infectious process are going to overpower us. So if the chain is not completed, then we'll not have a disease occurring. So I usually encourage that we bolster our own systems through proper nutrition or rest, and even the whole a complete wholesome kind of approach in terms of wellness. All right. So the three main elements that we're going to be considering today are the source of the infected organism, the means of transmitting this organism, and the susceptibility of the host. In infection prevention and control, like I said before, there is an authority that guides this this body. So the authority and responsibility will come through the Ministry of Health. You will have the chief executive officer within the healthcare facility. You will have the IPC committee with the IPC nurse and the IPC doctor, along with other key heads of departments or their designates forming this committee to make infection prevention control happen. All right, so it's not a one man show. It is all of us, like team, together, each achieving more, or we are as strong as our weakest link. So in infection prevention control, it's all hands on deck to ensure that this, prevention, this insult to the client is averted. All right. So some considerations in IPC, it's almost like some pillars. You will have universal precaution. Formerly, we would have called it standard precaution. You will have the development of isolation procedures, education, monitoring and surveillance, reporting, and continuous quality improvements. And we're going to be looking at each of these individually. So with universal precaution, as I said before, also known as standard precautions, it's the ground rule, right? The ground rule for infection prevention control, where you know that you apply this kind of standard in all situations. So we don't just run and put the gown on or the mask on or the glove on because you got a call to say that the patient coming is X or Y. Or it's my colleague, so because it's my colleague or my friend or my family member, even though they're coughing at you or they're bleeding, it's my friend, so I'm just jumping in. These are standards, these are measures that you use in all situations. So basic IPC situation, which is safeguarding the practices that must be applied all the time, in all circumstances, with all patients, with all persons. So this is the ground rule, universal or standard precaution. And every other precaution is built on universal precaution. All right. So development of isolation procedures. Over the years, for those who have been affiliated or in nursing for some time, you know that we have long been saying we need to have isolation areas, and there's always a big challenge where you're told that these buildings are old, they were designed a particular way, and so it's difficult now for us to get the systems in place, the rooms that are um, HEPA filtered rooms, that kind of a thing. But development of isolation procedure is one of the very important or area that we look at in our infection prevention control. So this involves all institutions offering care, and to have a designated area for separating patients according to the level or categories of the risk for transmission of organisms. All right. So like I said, added to the standard precaution, there's also transmission-based precaution. All right. So this is where you'll have the standard of you looking at if you're going to be what are you going to be coming in contact with, and what organism might be presenting, so you know what it is that you're going to need to use, what precaution you need to put in place to protect yourself. All right. So there's droplet precaution, where you will use your gown, your glove, your goggles, your surgical mask. There's airborne precaution, where you're using your gown, your glove, your goggles, your respirator, your face shield. And there's contact precaution, where you have the gown and the gloves. And in the droplet, just explaining what the droplets are, these are large particles and they fall to the floor. So when you think about drop, think about the water dropping. So it's heavy, it falls to the floor, but it can be propelled 6 to 12 feet. All right. So an example of this is like in the cases of bacterial meningitis, the viruses that cause and the viruses that causes a common cold. In the airborne situation, these are very tiny particles and they remain suspended in the air, and then now the wind, will bring it along. So it can be suspended in the air for a little while and then be brought along by the wind. So note carefully that droplets under severe pressure, like suctioning, can then become aerosolized. For example, of airborne situations are in the cases of tuberculosis and measles, right? Contact precautions are, like I said, usually necessary for skin infections, and the hands. This is where the hands act as the main transporter, or commonly used items can be the transporter. Education, and as we all know, education is key. So, who should be educated about IPC protocols? Everyone: the patient, the visitors, the staff, both new staff, seasoned staff, and education is ongoing. It's almost like a cycle, because as you go along, and COVID-19 has taught us this, almost daily there is a new update. There's something that you may have to tweak, or something new you're learning that you have to add. So education in itself is a cycle that continues on and on. So you're new to it, you learned it today, and the next few months you need to review it, because when we're in training, we would have learned about the various precautions, when it's droplet precautions versus aerosol. But then if you're not working in the actual area, or you've never had a case where you had to use this kind of precaution, it's as if you don't remember, even though you were taught. So education is something that is ongoing, right? And it needs the new and the seasoned staff needs to be informed about the protocols and be guided on how to adhere to these protocols. Monitoring and surveillance. This is done regularly as well as on an ongoing basis. There are assessment tools that are used, there are audit tools that are used, along with quality control activities. And there's both active surveillance as well as passive surveillance. All right. And in active surveillance, it means that you are looking, you are going and you're searching each day. You go, you search for cases, you as an infection prevention control nurse, you go through the admission books and you pick up any cases based on the diagnosis. And for the passive ones, these are cases that would have occurred, that in retrospect you are going to get those reports. You're going to know, recognize that, oh, we had an outbreak because of X or Y. So there's both active surveillance as well as passive surveillance. Reporting. Now, reporting is a very important part, because there's a system where you want to know what is happening, and you have a channel that these things must be, reported, so that the link of persons who need to respond can be activated. So there are investigation forms. There is a class one reportable book. There is the case investigation form. So for every communicable disease, for example, there is a case investigation form. For COVID-19, there's a case investigation form. So even if there's a newly developed disease, there is usually, and it has concerns for IPC, usually there is going to be a case investigation form that will be generated so that the data can be extracted. Specific data, demographic data, contact details, travel details can be extracted so that the technocrats in terms of the health departments and can make informed decision. Do I need to lock down this community? Do we need to go in and do more teaching? Do we need to whatever? All right. There are various forms for communicable and other diseases of IPC concern as well. So IPC is a policing system, right? So there's lots of reporting, there's daily, weekly, monthly, etc. And these reports help to identify trends, like I was saying before. So informed decisions can be made. And each healthcare facility reports to a local body, a regional body, an international body sometimes, depending on what the health event is or depending on what the disease that is happening is all about. So the more communicable communicable it is, then the higher it will have to go. Because some of them will have international interest. For example, even COVID-19. If you notice each day on the news, you are updated. We are given daily updates to see the number of cases, the number of tests that were done, number of positives, the number of deaths. All of that is a function of infection prevention. Continuous quality improvements. So after you have identified the trends, after you have identified, you've reported what is happening, you have done your active surveillance and you know this is happening, then there are certain steps that you'll need to take. So you will understand that, there's an outbreak of, you may see a lot of children coming in with vomiting and diarrhea, and they're from a particular school, for example. So then you'll be alerted that perhaps we need to go into that school. Then we're going to be asking some pointed questions to find out, could it be a foodborne? Could it be the water system? So all the multiple disciplines would come on board there now to do that kind of an investigation. And then the recommendations that are made would be implemented. They'll be implemented, and then a review to ensure that these are the standards that are going to be adhered to, so that you don't have a recurrence of this kind of a situation. So you may need re-education sessions. There might be reevaluation, where there will be reevaluations for the improvements that have occurred because of whatever you have detected and fixed. All right. Now, the World Health Organization describes 5 moments of hand hygiene. All right, hand hygiene is the next level of concern for infection prevention control. And hand hygiene, I know Susan never said hand washing, hand hygiene is one of the most effective, noted effective way of reducing the spread of infection. All right. So as simply the task of hand hygiene, it goes a far-reaching way. And like I said before, it's as if COVID-19 has become a magnifying glass. So everywhere you go, you're required to clean your hands. I saw a WhatsApp, a video with little children, and it's as if every little implement that they've seen around, they're putting their hand under it, thinking that it might be a dispenser, an alcohol dispenser. So hand hygiene is one of the very, very big pillars in infection prevention control. So the World Health Organization describes 5 moments when hand hygiene is necessary. And they have various charts for various healthcare facilities. So they'll have one for general healthcare, they'll have one for dental, they'll have one for probably the long-term care centers. But this is basically the foundation of the 5 moments. So when do we perform hand hygiene? And by hand hygiene, we are referring to whether it be with soap and water versus alcohol hand gel. Now, soap and water is always the best, always the recommended. However, we have recognized too that the alcohol hand gel or hand rub is as effective in, especially with those with alcohol content of over 62% and more. All right. There are certain situations, however, especially those disease processes that involves the GI system, where you are recommended to use soap and water, as well as times when your hands are visibly soiled. So once your hands are visibly soiled, or you have handled um, like feces, then you are encouraged to use the soap and water. Outside of that, no visible soiling on your hand, but you need to ensure hand hygiene is done. The alcohol hand gel can be used. So when do you use them? Before you have your interaction with your patient, all right? Before you perform any procedure. And most times we would remember before performing the procedures. For example, we're going to be catheterization. Most times we remember that we need to perform our hand hygiene after you've been exposed to body fluid. And sometimes we take this thing for the exposure to body fluid lightly, because one, we may have been wearing a glove, so you may have gone to empty the urine bag, but because you had the glove on, you are having a false sense of, oh, I had a barrier, so I don't need to wash my hands, and I didn't touch the urine. I only just opened I just released the lever and clamp it back. But then you can never know what you would have been exposed to. So that in itself will be considered to be a body fluid. After you have interacted with your patient and after you have touched the environment surrounding the patient. So you have gone to the patient bedside and you have pulled the screens, you would have probably adjusted something, then you also need to remember to do your hand hygiene. So that's before you have interaction with the patient, before you perform any procedure, the aseptic clean or aseptic procedure, after you have been exposed to body fluid, after patient interaction, and after you have touched the environment. Those are the times that you need to do your 5 moments of hand hygiene. All right, so like I said, we're gonna do a little Jamaica moves. I can't see the persons who are here. Um, I don't know if we are able to do a little movement where we are. Be true to yourself. Do a little shoulder move. Don't know if you know the coconut where you do you see your O, you see your O, the N, the U, the T. Just a little movement to get us stretched and ready again. We're ready to go? Anybody ready to go? No one speaking. You're
Yes,
ready to go? Let me see a
ready.
reaction
We're
from
ready.
your.
We're ready.
Okay, good, good. All right, I thought I was here by myself. All right, all right. Another big area in infection prevention control speaks to our personal protective equipment. Now, the new buzz, personal protective equipment. I believe previously we would have probably taken it for granted that the only personal protective equipment was a gown and a glove and perhaps a mask. But no, we do know that there are quite a whole lot of other um, personal protective equipment. And even during the time of Ebola, that came out as well, as to the different hazmat suits that can be a part of your personal protective equipment. And by personal protective equipment, it is just speaking to the equipment that you use to ensure that you're protected as you offer care to those around you. All right. So before choosing your personal protective equipment, there are some considerations that we'll have. What am I going to be doing? Will I be exposed to body fluids? How close will I be to the patient? And will this procedure create aerosols? So you ask these questions and then you decide what PPEs will be necessary to use. All right. So the gown, the eye protection, the mask or the respirator, the glove, and like I said, in the case of the Ebola, you would have the hazmat suit, you'll have the water boot, you will have the well, the gowns can go in their various types now. With the onset of COVID, we would have been a little bit more highlighted or alerted to the various type of gown, the water resistant gown versus just the disposable that would have worn before. The eye protection in terms of the goggles, the mask. Now, before, would have known just about basically the surgical mask and the respirator or the N95 mask would have been something that would have seen every now and again. But because of COVID-19, we are seeing a lot more and different types. We even gone into the whole standard of having mask fit testing, which we were not paying a lot of attention to before. So those are some of the things in terms of your own personal protective equipment that we'll think about. So in donning or putting on your personal protective equipment, the first thing that we will do, which is the ground rule, is your hand hygiene. All right. And then you'll usually put your gown on, then you'll put your mask, you'll put your eye protection and your glove. All right. I usually say in my presentations, with the exception of ensuring that you have satisfied your hand hygiene, the donning is not a big issue in terms of have to be regimented and follow all the rules. But the important time that you need to be alert is when you're doffing or removing, because at that time you'd have had a contaminated set of PPEs on, and you don't want to in the process. So you went, you put on all your personal protective equipment, and you cared very well for your patient who has some communicable disease or is infectious, but then you compromised when you were taking off and got exposed. So when you're doffing, you have to be even more alert at the doffing, right? In the donning, you need to ensure that your hands are clean, because if you would have put on, say for example, your mask with contaminants on your hand, then you would have already compromised the whole effort. So that is why it's important that the first thing that you do is to use your hand hygiene. All right. So in Dolphin, like I said, the PPE should be removed in an order that minimizes any potential for cross contamination. All right. So the order is as follows. You would say the most contaminated would have been your glove, because that's what you would have been using to touch. So the gloves are removed, all right, and then you clean your hands. So even in doffing, the hand hygiene moments might be even more increased, because there are other persons who purport that once you have taken off the various layers, in between taking off the layers, and especially when you're going to your face, that you make sure that your hand hygiene moment is done before that. All right. So you remove your glove first, then you remove your gown, and there are various ways of removing. There's a method of removing glove with gown, as well as a method of just removing the gown only. All right. There's also the method of removing your glove. So I have a slide that will speak to the method of removing the glove. So let's talk about removing the gown. In removing the gown, we have to remember that what is in front would have been contaminated. So the rule is to try to encapsulate the front of the gown. So you reach to the back because your back is considered to be clean. So you'll reach to the back, and you will release the strappings at the back, and then you're basically trying to tear or pull the gown forward in a encapsulating way away from yourself to prevent that kind of a contamination. There's another method where you can actually use your glove to grab the gown and almost breaking it forward. Sometimes, though, if you have not practiced that, that can be risky, especially if it is that there are, like substances on your gown. Say, for example, you might have been splashed with blood or something. You don't want to be unnecessarily displacing those particles that would create problems. So in order to use the method of grabbing and pulling forward, you really it has to be something that you would have practiced over time. Outside of that, you use your removal of your your glove method, and then you sanitize, you perform your hand hygiene, and then you reach to the back, encapsulate the gown, pull it up, and you put it in the bin. Another important thing with the doffing too is the placement of your bins. You don't want to be walking across the room to go find the bin to dispose of. You want to have the bin as close to the area that you're doffing as possible. All right. And like I said, in other areas or in other customs, there is the encouragement that you do your hand hygiene moment prior to taking off your anything that is covering your face. All right. So the eye protection, you reach from the outside. There are some straps that may have two some eye protections that may have two strappings. So you usually start with the lower one first and then the top. All right. Same thing for the respirator. And at the end of the process, you want to ensure that you do your hand hygiene, but this time with soap and water. All right. So here we have the slide that speaks to how you safely remove your glove. And I have this slide now because a lot of times we would the most commonly used PPE is going to be the glove. And sometimes we would have contaminated ourselves if it were that we were dealing with an infectious case by virtue of just how we remove the glove. Sometimes even putting other persons at risk. I don't know if you ever had the experience where someone is taking the glove off and then it just splashes everything. So if you were in close proximity, all of that would have just splashed on you. So removal of the glove is a very important thing. When I'm demonstrating this, I usually put some water on the glove, allow the persons to put the glove on, and then wet their hands so that when you're taking it off, you can actually see what is happening. If it were that we would use the water to represent the microorganisms when it connects back with the skin, or when we flip it off and it just does that flip, then all of the water is usually propelled. And we can imagine if microorganisms are there, it's also possible that, we could displace them and then put someone else at risk. So in safely removing your glove, you are going to you could start with your dominant hand and you pinch, all right? Pinch the outside and then you peel towards your fingers. When you have peeled that out totally, then you drop it in the other glove hand. Then you use one finger and push just under the cuff, and then you're basically using that finger to peel it over the other one. So both will be now encapsulated in a ball. And like I said, the disposal, the bin is very close by, so you would drop it right in the bin. Then you perform your hand washing. And like I said before, many times we believe that because we have worn the glove, we do not need to wash our hands. But remember that it's a personal protective equipment, but there are times when there can be compromise in that equipment. And you don't want to wear a glove because you don't want to wash your hands, because there's nothing that can suffice you washing your hands in terms of physically removing those organisms that might be on your hands. So hand washing is always done, even after you were wearing your glove. All right. I didn't share it in my presentation, and I really should have, because this is also another big burden in infection prevention control. The way the disposal of waste, the different color coding for the various systems of disposal. So you'll find that you'll have the black bag, which is used for the general waste generally here in our country, and you'll have the red bag that is used for the infectious waste. Our system is burdened now because persons do not recognize that there's it is important for us to have that separation for the non-infectious and the infectious, because the way we get rid of infectious waste, if we overburden that system, it creates a backlogging it creates more risk. It means that these garbage would pile up, and then you will have other risk factors being coming into play. For example, our general waste will go to the general dump, and you don't. There are persons who actually go to the dump to fish for their food and their livelihood. So if we should have dispose of something that is infectious in the black bag, then you would have put a whole set of persons at risk. All right. So it's very important that when we are disposing, when we are throwing our garbage away, that we are mindful that it's important for us to dispose of the non-infectious waste, the wrapper from the IV bag, the paper, the hand towel after you've washed your hand and dried your hand. Those are to go in the black bag. The food boxes. Sometimes you see persons drinking or eating their lunches and then they just go and they just put the food box in the red bag, which is not supposed to be. There's also a system where in most of the facilities that they try to remove food in one way, and then the infectious waste are removed in one receptacle, and then the non-infectious are removed in another because they are going separate places. All right. So I want to encourage us, if we never paid attention before, it's very important. Some persons don't recognize how important it is, but it's very important that we dispose of our garbage in the correct receptacle. So blood stain, body fluids, infectious waste, always in the red. Non-infectious waste, regular household, regular paper wrappers for different things, that goes in the black bag. All right. Ouch. So it's time now to look at the management of sharps. And the management of sharps is another very important area, because over the years we would have seen quite a lot of needle stick injury. And through needle stick injury, this opens the portal for you to be exposed to bloodborne diseases. And that is not a nice feeling to be exposed in that way. So it's very important that we manage and dispose of our sharps in a correct way. I'm from the old school, so we would have been taught to use sharp stray. It seems as if that is becoming almost extinct. But it's very important that when we're managing or using our sharps, that we have a tray, a specific tray that we will transport it to, and that we'll have our sharps container ready near to dispose of that. All right. The safe management of sharps. So there are various sources of sharps, and this list is not any, by no means exhaustive. There are blades, needles, we have granula, sometimes the very ampoules that we're using or the vials sometimes may break. And it's very important that we dispose of it. And like I said before, once we're going to be handling the sharps, that we have a tray that would lay it in. So even after you have used, you can put it back in the tray so you don't have to have direct contact with it. So that further minimizes the risk of you being stuck and becoming exposed to our body. All right. How many persons know of a sharp stray? Anybody familiar with sharp stray? Those students who may be on the line, anyone familiar with using a sharp stray? Yes, no, maybe so.
Yes, from the old school.
What
Sharp
about new
container,
school?
small one.
Right. Anybody from the new school have seen sharps containers, sharp stray in the areas that they may go to? No? But that's very important. And what I usually encourage is, if you are not seeing it, you can also be creative. And are they going to be using a kidney dish, or you create it? And I realize quite a few persons these days actually go and actually purchase their own little tray, but they're using it to like take around their pens and so on. But the sharp tray is very important. The non-touch method, right now, the recapping is not utilized or it's not promoted because persons are holding the needle and capping it. But the non-touch method can be used. So usually you're told not to recap. What happened in our system though, because of how the actual sharps containers are, it's good if you are able to do that non-touch method because it offers even more security in terms of the persons who are disposing of that sharps container being exposed to needle and needle stick injury. All right. So if you have to recap, you have to do it using a non-touch method. By that I mean the cap is laid on a surface and then you bring the needle to it and then you allow it to use that same surface to clip it in. All right. If it is not available, like I said, you're going to be using your sharps tray anyway. So you just use your sharps, replace it in the tray, and then you take that tray and then empty it in the sharps container. All right. Now, this is something that we may not see in our healthcare setting, where the placement of the sharp receptacles most times. Where do you see it most times? Your sharps receptacles, your sharps container. Where is it mostly seen? Anybody? The sharps containers are usually on ground. Say
On in
On
a
the ground.
corner.
On the
that again.
ground.
On the ground in a corner somewhere. Yes.
Right. So this is the actual standard. It's really supposed to be at your eye level. So what they're purporting here is that most people, are between 52 to 56 inches in terms of their height. So if you're able to fix it, the ideal standing installation height for a fixed sharp really is the 52 to 56 inches. So for those persons within your institution, if we're able to get that, system in, probably through the carpenters or so, this is actually the best way to have it mounted where you're able to have eye level to drop it in. All right. So this will reduce the possibility of the needle stick injury as it is at eye level. So you're actually seeing what you're doing. And I'm believing too that it may even promote persons closing off the container when it's at the 3/4 fill line. Because every sharps container comes with that description where the 3/4 full line is there and it says do not go above this. But still yet, sometimes you see people using the sharps container to become a floral arrangement. They see them sticking out and somebody coming to put one more little one on it. And when you do that, those are the times when you have risk for getting stuck. So we really want to practice to only bring it to the 3/4 line. I guess sometimes persons might be saying, boy, it looked like a waste man because there's space in it. But the space in it is for a reason to prevent the person who is going to be taking it away finally from them being so compressed that they're sticking through, although it should be a hard container. But if it's under pressure, then the risk of them sticking through, because as I said, most of the times we are not recapping because of the risk involved. So you don't want to fill it to the brim and then things are bulging through and the risk of the person who is taking it to final disposal being exposed as well. So your sharps container should be filled the 3/4 level, and then it is sealed. When you seal it, you really should write on it the date that it was sealed. You write where it is coming from, which hospital, the ward to, and a signature. And this is in the event that there's an exposure, at least some kind of backtracking can be done to figure out where this came from and the possibilities that might exist. So this is how we ensure that we seal the sharps container properly. All right. Now, occupational exposure to bloodborne viruses. This can be very terrifying. I'm not sure how many persons have ever had an experience or know of someone who had an experience. A lot of times when persons are exposed to a needle stick injury, they remain silent. They don't say a thing. I don't know if it's embarrassment, I don't know if it's fear, but it's very terrifying. So, all right. And like I said, it's important that we use the appropriate PPEs to begin with. So if it is that you're wearing your glove, then that would be considered an additional barrier to reduce even the exposure that you would have had if you would have gotten stuck. All right. And also, if you're using your sharp stray, then that in itself too will further reduce the risk of you being stuck. If there's an exposure, however, due to a needle stick, then the first action is to wash the area thoroughly with soap and water. So you go to the pipe immediately, you wash the area properly with soap and water, and if it is still bleeding, then you need to add pressure after that to stop the bleeding. All right. And after that, now you're going to be noting exactly, so you're going to be assessing the area where the injury occurred. You want to see exactly where it was. Sometimes when persons are exposed through a needle stick, they don't even remember because they panic so much. They're just thinking HIV, oh my God, I'm dead. So they don't even remember where it was because of the panic. So you need to be mindful where the event, where you got stuck, what size was the sharp instrument that you use, if it was a needle or a granula, what was the size, because the larger the bore, then the more of the blood that can be stored within the bore, and then no, that would have increased the risk, as well as if it is closest to like a blood vessel, then the risk. So a risk assessment is done based on those parameters. So it's very important for you to know the form that you fill will have the body parts in a numbered, each segment numbered, so you are able to, indicate exactly where it happened as well. If there was a splash to the mouth or nose, then you must go immediately and flush through the water or as soon as you can. Because, like, for example, you're in a delivery and you got, you really should run to it, but sometimes it depends on it at what point it is that you are. So if you're not able to move right away, you move as quickly as you can, and you make sure that you wash the area if it is that you have been splashed to the mouth or the nose. If it's to your eyes, then you're going to use your sterile water, your saline solution, and you're going to be ensuring that you flush those eyes or that area as best as you can. No bleach, no alcohol, no Savlon, because some person said, no man, I have to bleach this out. I have to use all of the high powered solutions that I know because I don't want to be exposed. It was just yesterday a doctor was telling us that there's a lady, even though she was mentally ill, she had intercourse with a man that she thought was HIV positive. So of course she used the J's and rinse out the vagina because she wanted to try and get rid of the thing, right? So we don't need no bleach. We don't need no Savlon. We don't need no alcohol. We just need to rinse the area, irrigate the eyes, wash with soap and water if it is needle stick. And then you're going to report the incident immediately to your supervisor and to the nurse that is in charge of infection prevention control. In the healthcare system, there's usually in our setting, my setting at work, we go to the accident and the emergency department. Some departments actually have occupational health departments that they can go to so that their assessments can be done. And based on the assessment, then it will be determined what, if they need post prophylaxis exposure and the type that will be used based on the risk that was identified. All right. So, like I said before, you complete the exposure report form, then you're going to report to the A&E or the designated area immediately, or 1 to 2 hours, or you try to go within the 24 hours. So it doesn't make sense that at 48 hours you would come and say, 2 days ago I was exposed. That might be too late. All right. Report the incident to the supervisor and the IPC nurse. Remain calm, do not panic. A blood sample is taken for you and the source patient for hepatitis B, HIV, hepatitis C, and the severity of the injury is assessed. Then the post prophylaxis is ordered if it is deemed high risk. All right. The post-prophylactic exposure is only for cases where there is a potential for HIV transmission, and the regimen is based on if it was your non in contact intact skin by contaminated sharp, and if it was your mucous membrane. So what they'll do, they'll look to see perhaps the HIV, yes, the HIV status of the patient. So for example, you were stuck by a needle that you used to give an intramuscular injection to someone who's HIV positive. Then they're going to be looking exactly where the injury occurred, and they're going to be, you know, exactly where it is. Was it close to a vein? How what was the size of the bore of the needle? Was it a large bore needle? So if it was a large bore needle, where they're thinking, okay, more of the body fluid would have been there, so your exposure would have been higher, then you'd be offered post prophylaxis exposure. It is not something that you're forced to take. So it's a conversation, it's an assessment, it's a assessment of risk, and then you're encouraged to take the post prophylaxis if it is that your potential for HIV transmission is high. All right. So it should be given immediately up to 72 hours following your exposure. And there is a repeat blood test for your HIV antibodies, hepatitis surface antigen, hepatitis antibodies, and this is done at 3 and 6 months respectively. During this time of waiting to have your repeat test done, it's important that you ensure that if you are sexually active, you're going to be making sure that you use your condom, because you don't want to confuse, you don't want to be exposed otherwise to HIV/AIDS and then think it may have been that needle stick injury. So there are some things that you will have to do during that time. All right. But like I said, it's very important that we manage the sharps, handle it, and dispose of it properly, just to reduce even the risk and the stress of having to go through this assessment and the actual post-prophylaxis, meds, because these are antiviral meds, which are quite a number of persons complain about how it makes them feel really ill. So the best thing is to avoid being exposed. All right? Hand hygiene. What is hand hygiene? And we spoke about that earlier. So it's not merely washing your hands, but it involves even the either soap and water or the use of the alcohol hand gel that has alcohol greater than 60, at least 62% alcohol in it. All right. So there are some common areas of our hands that are often missed during hand hygiene. And the dark blue areas are those areas that are most frequently missed, right? The lighter blue are the ones that are frequently missed, and the pink areas are the ones that are less frequently missed. All right. So we're going to be going through the steps. If you notice the thumb, sometimes just by washing, you have one thumb that is actually sticking out and you're only concentrating on the palm and not realizing. And then by concentrating on the palm, the tips of the fingers are usually sticking out. And so sometimes if you don't go through all the steps, you may not get all the areas. So I want you to kind of have this picture in your mind, and when you go to wash your hands, consider if it is that you think you may have reached all of those areas. There is a test that we usually do when we're doing hand hygiene sessions, where we give you what we call it some fictitious germ, like glitter, a glue germ, and you'd rub it on your hand, and then you'll be sent to do your hand hygiene, your soap and water, or your alcohol hand gel. And then when you come back, we'll turn the lights off, and then we'll use that a special light that will basically be detecting some little white spots, which is the remnants of that glue. And these areas that are highlighted most times, those are what you'll see coming out. And sometimes when you do this, it's very instructive. A lot of persons are like, oh my God, what I was in there washing my hands so long because I wanted to ensure that my hands are clean. But then they realize that if you do not follow the steps like we're going to be seeing after this video, after this slide, then it is more likely that you may miss some of these areas, right? So steps in hand hygiene. First, you wet your hands. And the reason why you're wetting your hands is that it will help the soap to lather. So you wet your hands and then you apply your soap. This looks like a bar soap in the picture here, but you know we are moved away from bar soap and we're using liquid soap. We moved away most of, well, from my hospital, we have moved away from a lot of the sinks being where you have to use your hand to turn the tap. So some non-touch, either you're using your knee to operate it or you're using your foot to operate it. So you get your soap in and then you start going palm to palm, and then you have an interlacing aspect. We're going to be going through the video, and while we're going to be going through the video, I want you to pretend as if you're actually doing it and go through the different steps. And in here they actually have, so there are different steps that you use to ensure that your thumb is gathered. In the video you're going to see where we go from the forefinger all the way up to the thumb. Because like I said, most times we will wash and then the thumb will still be left out. All right. There's also the interlacing, just so that you can get to the tips based on what we had before. So you can get to the top, the tips of the finger. And we also have the motion where you want to really get. And like I'm doing this now, it means then that it's going to be difficult for you to achieve your proper hand hygiene if you're going to be wearing the long nails that are all the way out here, as well as there are a lot of discussions, sometimes a little bit controversial, whether or not you should be wearing your false nails or whether or not you should be wearing nail polish on your fingers. Now, what is encouraged is that you have your nails short cut and that you keep them natural, because there's a risk of microorganisms slipping under the extension nails, as well as if your nails are painted and especially if it's cracked, then there's also the risk of them slipping under the actual paint that you put on. So for the healthcare setting, what is recommended is really your natural nails, which are short cut, all right, so that you're able to achieve that proper hand hygiene as you go along. All right. Now this is a video going through the steps, and like I said, I would like us to go through with the video. Just pretend as if we're actually at our hand hygiene moment. Let's get it to play. It's on play. All right. I'm not getting it to play. Give me a moment. Can find quickly. Can't find this video. I'm coming. Sorry. All right, I think I have it now. I'm sorry. All right, so like I said, so we are wetting the hands. Like I said, in our setting, we may have the non-touch sink, we have the non-touch soap dispensers, non-touch alcohol, hand towel dispensers. So we're rubbing our palms and insulating the two. And what is promoted is that you sing happy birthday, the happy birthday song twice, cover the 20 seconds minimum that you should be washing your hands for. Okay?
Excuse me, we are hearing the sound of the video but not actually seeing the video.
Oh, you're not seeing it. Oh. All right. Hold on a little again. Are you able to see now?
Yes, we can.
Okay, thank you. Sorry about that. I had to get some technical help. All right, so we wet our hands. We're now lathering. We're rubbing palms and hands, palm to palm. Right, the interlocking, the back of the hand. And whatever you do to one hand, you do to the next. The one doesn't get jealous of both hands. Yeah. So the inner locking now. So remember, we spoke about the tips of the fingers sometimes that get hit. This will help. You do one on the left and then you reverse. Alright. Then now we get to the stomp. Get to the stomp. Then we go all the way up to the tip of the stomp. And that now is for the top, the tips of the fingers, like I was telling you before. This way, you will definitely reach all of those commonly missed areas. Because if you remember, the commonly missed areas had to do with the thumb and the very of the when we do this, like I said, it's about minimum 20 seconds singing a happy birthday to you, which twice, happy birthday to yourself. Then you should properly perform your hand wash. That's the hand, clean hands, safe lives. That's one of the what's the one of these companies. All right, so we can get back now to the presentation. I'm sorry, we'll just go back down.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I want to demonstrate how to perform hand hygiene by using soap and water. There are two ways a nurse can perform hand hygiene. One way is through using soap and water, and another way is through using an alcohol-based hand rub. So when do
Yes,
you
we
want to
are.
perform
Yes,
hand
we
hygiene?
are.
You always want to perform hand hygiene before and after patient.
Stop. I didn't stop. Stop. I'm sorry. It's still there. Still hearing, man.
Oh, it's gone now.
It's gone?
Yes, it is.
So you're not hearing it anymore?
No, we aren't.
You are?
No, no, we
Okay,
aren't.
all right, great. All right then. So we can continue. All right. So that was a step in hand washing, and in terms of the hand hygiene with alcohol gel, it's basically the same areas with the exception that we would have the soap and the water. All right, because like we said, we wanted to ensure that we were covering all of those most frequently missed areas. All right. So the functions of the IPC nurse. Now, the functions of the IPC nurse include regular monitoring of and surveillance for the class one reportable diseases and other health events, the reporting of findings locally, regional, etc., educating of staff, patient, visitors, so the education part of it, the charting or chairing rather or co-chairing of the Infection Prevention Control Committee, and generally just that glue that binds all of these functions together. And the reason why I mention or associate it with the glue is that on your daily rounds as you go to do your daily monitoring, there are a lot of issues that persons will be coming to you with. Sometimes they're not directly related to infection prevention control, but there is the thought that you because you would have gone through you have to go through all the areas you are to intervene to try and bring closure to try and create that gap, close that gap between what is happening, what should be happening, what we've been complaining about, this light not working and all of that. So it's really sometimes the glue that ties everything together. All right. So in our regular monitoring, like I said, we would be going into the areas to do active surveillance where you're trying to pick up the cases. You're trying to recognize if there is something that looks like a trend, to identify some of the practices that should be happening that are not happening. You're observing to see if the management of the sharps is being adhered to. You're observing to see if the hand hygiene is being carried out. Sometimes you have to go in and you have to do audits before the other there's usually audits that are internal versus audits that are external. So it requires a lot of auditing to pick up where there might be non-conformances that you need to do some quality control management to get persons to be on par with what is happening so that when the external auditors come, things are basically in line. So there are some tools that you use to try and get this done. So the reporting now, the cases are reported on a daily basis. Some are reported daily by virtue of a class one reportable. This is any health event of a communicable disease that may have already been eradicated, or you may have indicators for a communicable disease that you're monitoring. For example, if a baby has a neonate between 0 to 28 days have sticky eye, you'll be reporting on the ophthalmia neonatal just so that there can be further checks into the mother's antenatal history, what's happening with her to pick up if we're having an issue where that is concerned. There's also the continuous education. At the start of the presentation, I reminded us that education is key and it is ongoing, it's a cycle. So all team members, everybody involved have to be reminded, this is how you wear your mask. Right now with the COVID-19, we have to be assisting to ensure that persons are remembering to maintain their social distancing, persons are wearing their masks appropriately. So all of this is happening on a daily basis as you go along as the infection prevention control nurse. All right. So we want to go into an evaluation time. I would like to find out from the participants here. How many participants do we have again? Let's see. I'd like to find out how many persons actually have an additional device with them, or is everyone using their sole device? May I see a show of hands of a reaction for persons who have an additional device? Participants? Gary?
We're not hearing you clearly. It's breaking up.
Oh, I'm breaking up. I wanted to find out how many persons have an additional device differently from what they're using to log into this presentation. I wanted to go through a session with Kahoot, a game, but you would need an additional device. I just wanted to have an idea so that I know if we could go into that. Can I have some responses, please? Anyone? Somebody respond.
There are some persons who are saying yes on
I have
YouTube.
only one. I have
Oh,
only one.
Only one. Okay. All right. So I'm going to have to use my. I'm going to have to use my. All right. I'm going to have to use my.
A few persons in here are also saying yes, but it may not be enough. I don't know how many you'd like to have.
I'm going to still bring the game up, but I'm not going to use the method that I had planned originally. I'm going to use a modified method. All right. Give me a moment. Let me bring it up, please. Hold on. Give me a moment. All right, so I'm going to have to log in. All right, so I'm going to log in. I'm going to log into this game so that you will see what it would be like. I don't know how many persons have actually participated in Kahoot before. So that the questions will come up. Give me a moment. So for those who can join, you go to your search engine, you type in the Kahoot it, and then you're going to select the play Kahoot learning games. You're gonna select play Kahoot it. You're gonna select play, and then you would put in that game pin that is there for those who can perhaps join in. So if you have another device and you are able to, you could actually join in. Just waiting to be logged in, and then we'll start. For the others, for persons who are not going to be joining in, what we'll be doing, we will just, I'll give you some time to read the questions, and then you can type in the chat your responses or type on Facebook what you think your response is going to be. All right, so CD is in. So I guess it will be anybody to challenge CD?
Could you repeat the instructions, please? So I am in the search engine. I typed in Kahoot.
Right, and then you're gonna select play. Then it will give you an icon to the game pin, and the game pin that is being displayed, you will enter that 70708. It will give you an option to name yourself.
Okay.
Other persons, then what you do, you will type in the chat.
We're not hearing you, Lillian.
Oh, I'm too low. You're hearing me better now?
Yes, we are.
Okay, I'm sorry about that. All right, so we have Grid, we have JM, we have Sophia, we have LW and CD who are inside the game itself. Anyone else trying to log on?
Me, but I just not getting through. All right.
Sometimes it's difficult because I'm trying.
Game pin. All right, I'm seeing that.
Right.
Yes.
Oh, you're seeing it. All right.
I hope I get in.
All right. Anyone else trying to log on? So what will happen is that the persons who are logged on, you will actually, okay, KHB, so I'm going to give you a few more minutes, persons to log on. You will actually see a podium that will show you who is first, who is second, who is third. So the first person to select their responses, they are automatically, it's a timed event. So the quicker you select your answer and it's correct, the more points you will receive. All right, and like I said, for those persons who are on Facebook or don't have another device, you can quickly type in the chat. I'm gonna give another minute for those who are joining. We have 10 participants on. So I'm gonna give another minute. Okay, 11. Can we make it to 15? Any more? 12. Anyone is trying to join? All right, so we have 12, 13. Just indicate if you're trying to join. So, because once I've started the game, you can't join on the system. You would have to use a mode of typing in your responses. Anybody else trying to join?
There's no one indicating thus far.
Okay, all right, so we are going to start. All right, so the questions, I will read the questions out loud as well. And then you will see the icons pop up on your phone, the colored icon. So the colored icon that represents the answer that you're choosing, that's the one that you're gonna click on. The quicker you click, then you're gonna see who is leading, getting contacts or. All right, So I'm seeing 14. I'm going to wait. 5, 4, 3, 2, 1, 15. All right, so I'm going to start. Thank you for those who have logged on here as well. So we're going to start. Here is question number 1. So it's evaluation time. So question number 1, true or false? During hand washing, the thumb and fingers are the least washed areas. True or false? During hand washing, the thumb and the fingers are the least washed areas. And you see the timer. You have 6, 5, 4, 3, 2, 1. Time out to answer. All right. So 6 persons answered that correctly, true, and 1 person incorrect. All right, next. Okay, question number 2. So you see JM is leading with 953 points. How are the answers in the chat?
There
Feedback
are.
in the chat? They're there.
Oh yes, there's 1 false from Andrea Watson, and there's 1, 2, 3, 4, 5 truths. 6.
So that answer was right. Number 2. PEP stands for personal equipment for protection, post-exposure period, post-exposure prophylaxis, post-exposure pills. PEP stands for. Right, so it stands for post-exposure prophylaxis. So 8 persons answered correctly, and 1 each incorrect. What were the answers on the chat?
In the chat, we have post-exposure prophylaxis. Midwife Rochelle Rochester said the first one, and 1, 2, 3 people said 1. 1 here.
As in the first response?
Right. Personal equipment for protection.
So that would have been incorrect. So the post-exposure prophylaxis is what the PE stands for. All right. Let's see who is leading again. All right. True or false? Should you squeeze area then wash immediately after needle stick injury? True or false? Should you squeeze area then wash immediately after needle stick injury? Right. So 6 persons said true and 5 said false. Why is it false? Why did they choose? Why is the answer false? What's the catch in this question? What did we say we do after a needle stick injury?
Wash with soap and water.
Right, you wash with soap and water. Previously, we said you would have squeezed, but that has been refuted. So we do not squeeze the area. Some persons believe as soon as you get that injury, you squeeze it. But that is refuted. What the rationale for that is when you squeeze, you're basically creating more damage to the tissues, and when you have damage to the tissues, then all of those fighting systems are going to be running to the side. So if there is a high risk exposure, then those same fighting organisms are going to grab that infected exposure tissue or blood, and it's going to be taken back into your system. So the important thing to do is to wash away particles or any exposure, any blood, any contaminated body fluid before you start.
This is Louis McDonald. Your audio is in and out. I'm not sure if.
I'm not sure. I'm sorry. I'm holding the thing right up to my mouth.
We're hearing you better now. Yes.
You're hearing me now? Right. Yeah. So I'm saying when you squeeze, you're going to allow all of those fighting systems to run to the side. And if there is contaminated blood, it is only going to hold on to that contaminated blood and then run back inside your system. So you're gonna have more exposure than you washing that away, then you create that hemostasis in terms of stopping the bleeding. So you don't want to be squeezing and creating damaging to the system around you to create an inflammatory response. That's not what you want to do. That is why you have stopped squeezing. You just wash with soap and water, and then you create a pressure to stop the bleeding. All right. So on the scoreboard, okay, so KHB has taken the lead. Next question, true or false? Hand hygiene is the first step in donning. True or false? Hand hygiene is the first step in donning. All right. Lovely. So all 7 participants answered correctly. What was it in the chat?
In
Did
the
everyone get it
chat, we
correctly?
have 8 truths going so far, not seeing
Okay.
any false.
Okay, good. So everybody is on board with that one. And can anybody remind me what I said was the rationale for hand hygiene being the first step in donning? Any takers? Anybody remembers why is hand hygiene? Why is it important to have hand hygiene before donning or before putting on the PPEs?
To prevent contamination of the gloves.
Or anything that you're going to be putting on. All right, good. Next question. All right, so grid has moved up. Question number 5. Select the 3 elements needed for a disease to occur. Select the 3 elements needed for a disease to occur. Is it agent, host, airborne, precaution? Is it agent, mode of transmission, organization? Is it host, transmission-based precaution, organism? Or is it susceptible host, infection? Right. All right. So majority of persons selected the correct answer. All right. Very good. All right. And JM is back. Question 6, true or false? Droplets are large particles that remain suspended in the air and travels up to 6 feet. True or false? Droplets are large particles that remain suspended in the air and travels up to 6 feet. All right, 7 answers in. False, correct. Remember what we said, droplets are large, but do they remain suspended in the air? No, they drop. They're heavy, so they drop to the ground. So that's why false is the correct answer. All right. Wow, JM, you're hot. HB is coming back to get you. All right. Included in the WHO 5 moments of hand hygiene, except, so these are included except before clean or aseptic technique, before touching the patient, after body fluid exposure, after using the bathroom, which is not included in the 5 moments. All right, so quite a few persons got thrown off by that. So remember, we spoke about the 5 moments and we said before you touch a patient, before you do a clean or aseptic technique, after you have touched the patient, after you have come in contact with their environment, and which is the next one? After body fluid exposure. So I know some persons got a little distracted, but after using the bathroom is not one of the WHO 5 moments. Yes, we have to do our hand hygiene, but it's not one of the 5 moments that's described by WHO. All right. All right, so JM stays on track.
And there
Question
are
8.
responses in the chat for this as well.
Okay.
After using the bathroom was 1.
Yes.
Yes. Number 4. One person said their system is lost. That's Serena Douglas.
It's lost.
Mm-hmm. They
Oh,
lost their
okay.
system.
Oh, I'm sorry. Yes, because we had 7 consistent responses and then one person is lost for true. All right, so most persons chose the correct answer here. So needle stick injury and occupational exposure to bloodborne substances must not be reported. It must be reported. So we have been practicing not to report it, not to do anything about it. Just look at the patient record and, oh, they don't have anything, so it's all right, I'm good. But remember that there's a window period, so you really don't want to go without taking some kind of a step, and you don't want to expose yourself without any intervention. All right. PHB has taken over the lead again. Question number 9. The IPC committee consists of all the following except the pharmacist, the IPC doctor, the IPC nurse, the patients. So the committee consists of all the following except
In the chat, we have a pharmacy.
mm-hmm. But remember, I told you it would not be the pharmacist because remember I told you it's a multidisciplinary committee. It's a multidisciplinary team effort. So the pharmacist is on board because even though we didn't speak about it, there is the observance or you're in infection prevention control. You also want to ensure that there is judicious use of antibiotics because when a patient has been exposed to too many, especially the high-powered antibiotics, it creates the risk of them getting this multi-drug organisms in their system. And once this is in their system, usually it is there for life, basically. And that will create problems for the patient and also create contaminants for those or the risk of cross-infection for other patients. So the pharmacist is a key role, plays a key role in infection prevention control. So they definitely have to be a part of the committee. The doctor is a part, the nurse is a part. You wouldn't call the patient a part of the committee because they're the ones that we're caring for. We don't necessarily have a patient who represents there. We are all there representing the patient. So that's why the pharmacist would definitely be a part of the mix. And the patient here would be the correct answer. All right. All right, KHB is holding on. Final question. What PPE should one use when caring for a patient with measles? Is it the gown, the glove, and the surgical mask? Is it the gloves, the respiratory, the gown? Is it the gown and the gloves only? Is it the gown, the gloves, and the respirator? Which is it? All right, 6 answers in. And the gown, the gloves, and the respirator. Remember, we did say that measles is airborne. So we want to make sure that we have the respirator, which is the N95, which filters 95% of the particles. So that is what is worn when you are dealing with patients who has an airborne situation, similarly to what is happening now with the COVID-19. All right. So thank you very much. Let me see who is crowned the champion on the Kahoot platform. So in third place is Purple Share. Congratulations, Purple Share. And second place, JM, the constant contender, and the spotlight goes to KHB. Congratulations. And the runners up, close runners up, HB and CD. Thank you so very much for participating in the Kahoot and on the chat and on Facebook. Thank you very much for participating, those who
We
did.
had active participation over on YouTube as well, Madam Presenter.
Yes.
And they were giving good runs and answering. So we got some of the similar answers, all the trues, all the falls. the
Okay.
post-exposure prophylaxis, and the hand washing. And the last one was about the patient. There are a lot of answers that said the patient wasn't that one. And
Right.
then they have also guessed the gown, the gloves, and the respirator.
Okay. Very, very good. Very good. So I just want to give congratulations to those persons who were indeed quite attentive and responded correctly to our evaluation. Some of the references are here. And I just want to say thank you. Those who participated and participated well, just choose one of these lovely wrapped gifts and consider your appreciation. All right. I know that I would not have addressed every single aspect, even though I had 2 hours.
Okay.
I still could not have addressed every single aspect. But if you have any questions, any area of concern, then this is a time that you'll be allowed to ask your questions, or if you need clarification on anything, you can now go ahead and ask. Any questions?
This is Louis McDonald. Are you hearing me?
Yes, I'm hearing you. I'm hearing you.
Right. So earlier in the chat, there was a question from Mrs. Kadian Williams Harris, and she asked, is it routine for a hepatitis or HIV test to be done for the patient whose blood or body fluid was exposed to determine the risk?
All right, repeat that question. If it's routine for the person to have the hepatitis test done, the person who was the patient who is exposing the staff, meaning?
Right.
Oh no, no, no. It's not the patient. Well, the samples are taken off for both. The samples are taken off for both, but in terms of the person who would have been exposed, they are going to be monitoring you. We would expect that as a healthcare provider, you would have already been covered in terms of your hepatitis, having your hepatitis board. So initially, I guess a baseline would be taken from both the person who you're being exposed to and the person who has been exposed. So that will be done. But the staff now, 3 and 6 months, those are going to be monitored for you by chance. And that's needless to say, you were exposed. So baseline are taken for both patient and the staff, and then 3 to 6 months, it is the staff who is being monitored to see if their hepatitis and their hepatitis or HIV has turned up in their blood.
Thank you. Mrs. Garrix Lloyd, was there any on YouTube?
Not just yet. I know they're hearing just a little bit
Seeing,
behind
I'm
us, so
seeing,
I'm double checking for those on YouTube. I will put them
I'm
over
just seeing
here.
one. I just saw a question a while on the chat.
Right. So Miss John Richard is asking, when we go into an isolation room, where should we remove the PPE? On the inside at the door or on the outside at the door?
All right. So depending if you're in an airborne scenario, your bin really should be at the inside at the door, but you are going to remove everything except your respirator, so except your mask. So you're going to remove your gown, your glove, and everything, but you're going to keep your mask on until you have exited the room and you have closed that door. So if it is so if once it is airborne, then that is what you'll do. You remove all of that, excepting the mask. If it is not airborne, but it is highly contagious otherwise, and it's at the door because you really don't want to be going out. The ideal way that the isolation room should be is that you would have the bin by the door, and then as you step out, you'll actually have the hand wash area, the doffing area, that you will be able to wash your hands and come out. So it's actually right by the door on the inside, and you take the robe, and then as you step out, if it is respiratory, if it's a respiratory or airborne scenario, you wait until you have come out of the room and the door is closed. Then you go to that sink, wash your hands, then you remove the parts that are covering your respiratory or respiratory areas.
Thank you.
Any other questions?
Mrs. Venice Henry Williams is saying, I did not know that when the sharps container reaches the indicated capacity and is covered, that the date and institution should be written on it. So she learned that today. That's very good.
Because, like I said, the person who's disposing of it, if any injury happens, then you'll be good to be able to trace that.
Your audio is unclear. We're not hearing you clearly. Mrs. Louise McDonald, we did not hear that clearly just now.
Oh, I'm sorry.
Right.
No, what's happening with my sound? I'm sorry. I'm saying yes, because if the person who is removing or the final disposing of that sharps, if any injury should happen to them, then you would have an idea as to where, there can be some kind of tracing. And I know you may not be able to trace every single patient, but at least you will have an idea of what the risk. It would help in calculating the risk to the individual, where it's coming from.
Right. So I don't have any questions for you yet, Mrs. Louise McDonald, but the comments over here are excellent presentation. Thank you, Mrs. Louise McDonald. So interactive. I love it. No questions. Excellent presentation.
Thank you.
And we're also getting the good compliments over here in these chats as well. One person said, very informative and interactive presentation. Information very relevant. Excellent presentation. Thanks. Very informative and excellent presentation. Very interactive. Well done.
Okay, thank you. And I'm seeing someone ask about explaining the doffing of the PPE. Can you just open your chat and say exactly what you are asking? Are you asking that I go back over the steps, or are you seeking some clarity? Person who asked about the doffing. You said yes, but I gave two. Oh, the steps. Okay. All right. So like I said, in the doffing, it's very important that you are conscious that you're not going to be exposing yourself. So the steps in doffing are to ensure that after you have successfully cared for the patient.
Audio is unclear again. Not
Oh,
hearing you clearly.
better now?
Yes, it is.
All right. So the steps are to ensure that you are not contaminating yourself when you are removing or doffing. All right. So you're going to start with the item that is going to be considered to be most contaminated, which is usually the glove. I was explaining that there's a method of using where you take glove and gown off at the same time. But this method takes practice, because especially if you have had like a splash with blood or liquor or something, you don't want to be grabbing it and taking it off and then displacing any particles or any of the fluid. All right. So you can grab the glove, use your glove hand, grab the gown and pull it off, and then you do the same encapsulating. Or you can take the glove off first. So the first thing that you're gonna do is that if you're taking glove off first, you're gonna pinch the the sleeve of the glove, you're gonna raise it off your skin and you're basically peeling it off your hand towards your fingers. When you have done that, you're going to catch it now in the next glove hand, hold it in your glove hand, then you're gonna use your forefinger and you're gonna put below the sleeve of the other glove, and you're basically raising it up and peeling it towards your clenched fist. And then when that is also enveloped, you're gonna be disposing it in the glove, in the bin. All right, so that's how you get the gloves off. After you have done that, you if once you have your hand hygiene mounted, you do your hand hygiene. Then you reach to your back because your back is considered to be clean, and you loosen the either it's a Teflon gown or the strings. You loosen, and then you're holding your the right side back, left side back, and you're basically bringing it towards the front in an encapsulating way, and then you are going to be pulling off your so you're not touching on the inside, you're basically using the outer part of the inside of the back to peel towards the front in an encapsulating way. And after you've taken off one of, like for example, if your dominant hand is your right hand, you're going to be taking off the right hand first, free that up, then the next hand encapsulate that, and then you drop it in the bin. So that's how you do for the gown. And then after that, like I said, if it is considered to be that you're in an airborne risk, airborne precaution, after you have done that, you're going to be leaving the room, you're going to be closing the door, and then you're going to go wash your hands, and then you're going to remove your respirator. So in removing your respirator, you use the lower string, the one that is closest to the neck, and you bring it over. Then you're gonna kind of dot a little forward because you don't want it to fall on you. You want it to basically come off towards, the front. So you want to be getting it off into an angle so that it goes into the bin after that you're gonna be washing your hands. So that's how you do it. I hope that was helpful.
Very informative. Thank you.
Yeah. So where somebody said they had network problems.
Network problem.
Probably I'm having a little too because I don't know why the sound keeps going and coming, but that's how it is with the technology. All right. And I just want to say too, with the donning and the doffing, especially the doffing, because I believe more emphasis has to be placed with the doffing. That is something that we need to practice, because what happened, as I've often explained to persons, you're in for example, because COVID-19 is such a scare, when you're there, you're so preoccupied in wondering, my God, am I going to take this off properly? You tend to get a little nervous. It's good to kind of practice it so that when you actually get in the situation, the nerves not overwhelming you and you're making mistakes. And if it is that you have made a mistake, for example, you took off something wrong and you may have contaminated, then the safest thing to do is to do your hand hygiene as soon as possible. And just remember, once you're in an airborne situation, do not remove your mask until you have left the room. So that is important. If you take off everything else, once you're in an airborne scenario, do not remove your mask until you are safely away from the person or outside of the room. Then you can go wash your hands and take your mask off. So you wash your hands first, then you remove your respirator or your mask. All right.
All right, everyone. Is there any more questions in the chat? Anyone with a question wanting to open their mic and ask? Well, I'm not seeing any more in the chat. And Mrs. Garrix Lloyd, you're not seeing any over by YouTube, are you?
No, I'm just getting comments over here. Superb interaction. They love the idea of the game and they can tell that she's an infection control nurse. Very great presentation and a good refresher.
All right, well, I believe that is it for our
Thank you.
question and answer segment. Thank you so much, Mrs. Louise McDonald. I am sure we all could appreciate a presentation of this nature. As you made mention, in times like these, infection prevention and control, it's so important these days for our very own survival. It was a clear presentation, could not have been made any clearer. We thank you. And thank you to everyone that came out today for this presentation. We are happy that you showed up and that you participated in the seminar this afternoon. Mrs. Garrix Lloyd, thank you for having me, and I'll turn over to you.
Thank you so much, Ms. Lyon. Let me just add to Ms. Lyon's thanks. Thank you so much, Mrs. Louise McDonald. This was session 5 of our 7-session series, but today was the last one in the infection control section, and we went out with a bang. I was sitting here hilariously laughing at multitasking and not knowing all the answers or missing the trick parts of the question, and I'm like, wait, my son is doing PEP, I should be setting an example. So thank you so much for keeping us on our toes. It was a great way to evaluate not just today, but all the 5 sessions that we have covered so far. And we really want to thank you so much for closing out the infection control session with a bang. It was wonderful. So thank you also, Sidonia. I know that you were probably a little nervous. We want to give her an online or offline round of applause. She's one of our nursing students who's our member. And so she braved us today. Excellent. And I certainly want to thank all of our colleagues who have registered and participated actively, either on Zoom or YouTube. We thank you so much for the session. So we will see you next week, Monday and Wednesday, for the non-nursing hours that you also need to have. The great options. We're going to look at online platforms and online etiquette, because a lot of us, though we've been on Zoom or Go Meet or something else for over a year, a lot of us maybe either hosting or participating still don't know a lot about the platforms themselves sometimes and what we should or shouldn't do. And then on Wednesday, we close out our series with 3 great presentations that's going to help us to manage our wealth and or to build it if we didn't start yet. So join us next week too. But before we close off, as usual, we've been sharing something about Sigma and Omega Kappa, and I just want to keep that going. So if you've seen this logo anywhere, this would be the Sigma with the leaves. It says Global Nursing Excellence. That's the Sigma logo. And then usually all the chapters have their names attached on the right-hand side. And so this is Omega Kappa. So before I tell you about us though, I want to congratulate all the persons who participated. We had several answers and we got 4s, 5s, 3s, 6s, 7s, but we had 3 people who found 8, and then we realized it was really just 2. We asked them to reach out to us and say, let's see what numbers you found. And so we really only had 1 person who reached out to say that they were able to find 8 numbers. And so we want to also give a big shout out. Mrs. Louise McDonald, unfortunately, the presenter is not eligible for entry, or the moderator. So we are sorry about that. We didn't give the disclaimer. We want to congratulate from YouTube, Miss Kashika Livingston. She found 1, 2, 5, 4, 7, 6, 8, and 9. Congratulations to her, and we'll contact her regarding her prize. So now that we've said that, let me just tell you a little bit about Omega Kappa and Sigma. So I shared before, so if you heard it, you probably know, but 6 nursing students wanted some activity that would complement school, and they founded Sigma Theta Tau International in 1922 in Indianapolis in the United States. And so that's where our headquarters would be. And the vision of Sigma Theta Tau, called STTI, now just called Sigma, is to have connected, empowered nurse leaders transforming global healthcare. And our mission is to develop nurse leaders anywhere to improve healthcare everywhere. If you are interested to join Omega Kappa, You are able to do so if you are a student or if you are a nurse or if you're a nurse leader. So you'll be looking at joining over 135,000 active members in over 100 countries with just over 540 active chapters. So if you're a student, you want to be enrolled in a nursing program, a bachelor's program, or the equivalent, we expect academic excellence. We want you to be in the top 35% of your class, and you should have completed at least a half of the program. However, if you're an RN who is transitioning to your BSN, then we want you to have at least completed 12 credits. And if you're a graduate student, we expect you to complete it. You have completed a quarter of your curriculum, also to have achieved academic excellence and to meet the expectation of academic integrity. And for our nursing colleagues, we ask that you be legally recognized to practice in your country. So your license has to be up to date, have to be on the register. We want you to have a minimum of an undergraduate degree or the equivalent in any field. And of course, we want you to demonstrate your achievement in nursing. So Omega Kappa and Sigma offers career mentorship, access to professional development courses, a very large e-repository, the opportunity to network and volunteer. Many persons have expressed an interest to learn a little more about us and or to join. We will be contacting you after the series will be over, and you are also able to volunteer with us even before you join, so you can have an idea of who we are and what we do. And of course, we have a lot of chapter conferences, regional conferences, and international conferences, webinars, workshops, and sessions that will help to develop those nurse leaders anywhere. Now, this is our chartering in 2019, and I want to tell you how you can find us. We are at the US School of Nursing, Mona. Though we are there, our members are across the Caribbean, in Bahamas and Trinidad and Tobago. We have some in the US as well and in the United Kingdom. And you've been introduced across these 5 sessions to clinical leaders, to educational leaders, to our nursing students. And I wanted to share one last thing with you that's a little bit about us, but this is how you could find us on the Sigma Nursing general page, on the Omega Kappa general page, on our Facebook group, or at Instagram at Omega Kappa Caribbean. And I wanted to just stop this share so I could share one other quick one with you so you're able to see what I'm referring to. Let me see if I can find it for you. I have several things open. All right, so last 2019 was the convention. It's every 2 years that the Sigma has a convention where all chapters have to attend. And we visited Washington, DC in 2019. Now, this is the page on the Sigma site that's advertising the 2021 convention in November. And I wanted to just share that with you because you could go and look, but more than likely, although we are a multinational chapter and we had members from other countries, we opted here from Jamaica to go in all our Jamaican glory. And I just wanted to share with you that on this page advertising the next one, here are 4 of us standing out in our Jamaican colors, making an impact so that we're here advertising the convention in 2021 in November. So we want you to have a look. You can find other information. Tell us if you're interested. And again, we just want to say, a lot of our members, we have a way of saying, I think it was Miss Walker who was our counsel who came up with saying we're okay. We just want to let you know we're all okay, and we invite you to also be okay. Have a very good evening. See you next week and have a great weekend, everyone. Please be safe. Let's practice all that we've learned over these 5 sessions. Have a great night.
Great night to you too. Thanks for allowing me to participate. Blessings.
You're most welcome. Thank you. Bye, everyone. Thank you to everybody. Bye on YouTube. You're also able to find all the sessions just for the information on our YouTube channel.
Okay. Bye.